Hi, my name is Val Benka. I'm Director of Programs for the Alliance for Contraception in Cats and Dogs. We're so pleased to be a conference sponsor, and I'm sorry I can't be there in person. So we're doing the next best thing, a brief presentation on who ACC&D is, our work, and projects we think could offer value to the great work that you're doing. Like those in the audience, I'm sure, ACC&D envisions a world where dog and cat populations are effectively and humanely managed, improving the lives of animals and the people who care about them. Our means of contributing to this vision is very specific. Our mission is to advance non-surgical sterilants and contraceptives for cats and dogs and to promote their global accessibility. To achieve this mission and vision, we encourage scientific advancement through conferences and think tanks, as well as helping to motivate the Michelson Prize and Grants Program, which has created a U.S. $25 million prize for whoever first develops humane, safe, permanent non-surgical fertility control for dogs and cats, and $50 million in research grants to get there. We work to advance promising technologies for non-surgical fertility control. We build alliances with stakeholders for information exchange and to prepare for successful future product introductions. We develop and disseminate information and resources, all of which is available on our website. And we explore and advance related needs, things which will benefit non-surgical fertility control but have broader value as well. I want to take just a minute to talk about non-surgical technologies. At the moment, there are a handful of options available. Unfortunately, all have limitations, particularly for dogs who aren't under close supervision of a guardian and veterinarian. Limitations range from dosing frequency to safety profile to cost to regulatory approval and availability. More info is on our website. The most exciting future prospect is something called gene transfer, which could offer safe, permanent sterilization with a single dose. A U.S. researcher has seen promising results in cats in preliminary studies, and if all continues to go well, the focus of research will turn to dogs. We're likely looking at another decade before this would be on the market, both because of further research that's needed and the long process of regulatory approval. It's fair to say that this field is a marathon, not a sprint, but we are truly encouraged by the promise of the gene transfer technology. I mentioned that ACC&D explores and advances things that will benefit non-surgical fertility control but have broader value as well. And I want to talk about two projects in hopes that you'll find them relevant to your work. The first is marking and identification. One hurdle to successful non-surgical sterilization is a lasting way to identify treated animals, particularly free-roaming ones. Any identification would need to be applied without anesthetizing the animal, since anesthesia shouldn't be necessary for non-surgical fertility control. Recognizing this challenge, we've been working to develop a safe, humane, effective marking method for dogs and cats. It's worth noting that potential benefits of a mark extend beyond non-surgical sterilization to large-scale rabies vaccination campaigns, where one challenge is knowing who has been vaccinated in the weeks or months after the campaign. Another likely beneficiary is trap, neuter, return programs for cats. After some trial and error with other marking methods, our current focus is a microneedle patch tattoo, which is a small tattoo that goes inside an animal's ear that we've developed with the Georgia Institute of Technology in the U.S. The photo on the lower right is a tattoo simulation in a prick-eared dog. Taking a step back, microneedles are tiny dissolvable needles that contain a liquid. They're so tiny, in fact, that there are 100 in the patch in the top photos, and that patch is barely half the width of a person's finger. When you press the patch to the skin, the needles dissolve and leave behind liquid. Typically, microneedle patches are used to deliver vaccine, and in fact, our partners led a successful study using them to deliver rabies vaccine to dogs via the ear. We're changing the liquid that's delivered from a vaccine to tattoo ink, but we anticipate that the application and dog response will be similar. We've successfully trialed the patch in cadaver ears of animals euthanized for other reasons, which you can see in the lower left photo with ultraviolet ink tattoos. Next week, we'll start a small pilot study in pet dogs and cats. So stay tuned for results by visiting our website and signing up for our e-newsletter. If this study goes well, we'll be expanding to a study in a more real-world population. The second project to share is our ethical decision-making guide for field projects targeting dogs and cats. In developing some of our studies, as well as in conversations with NGOs, we found limited ethical guidance and oversight for conducting field work to benefit animals, be it research studies or common projects like rabies vaccination campaigns or community spay-neuter initiatives. There's work on research ethics in laboratory animals and vulnerable human populations, as well as in wildlife. But these don't really touch on the human element of working with owned or community animals in a field setting. Here's a hypothetical example to consider. A city has a roaming dog population in its city center. Some expatriates living in the city decide to launch a veterinary clinic focusing on spay-neuter to quote-unquote solve the so-called problem of what they call too many dogs. They don't consult the community's diverse stakeholders, including the dog's guardians, to A, help determine if spay-neuter really is the solution to the problem, or even if there is a problem for that matter, and B, to get permission to sterilize the dogs. The expat founders establish organization policies and hire local staff to implement them. Yet some board members struggle to see animals return to the community and, against the policies that they set, insist on keeping some dogs at the veterinary clinic, which is not equipped for long-term care. There's understandably community resistance to the clinic and project. Sheltered dogs have poor welfare, and there's no data on whether the spay-neuter program is working, or even what working means in this case. This hypothetical example reveals a number of ethical issues. Lack of consultation with stakeholders in the community, including dog owners and guardians, non-existent data collection before, during, and after the intervention, no informed consent or permission for spay-neuter, and arguably conflicts of interest having board members positioned to go against the organization's own policies. This is arguably an extreme example, but you might recognize certain struggles faced by animal welfare organizations in this story. Making some changes, oftentimes really small ones, can make all the difference in both the ethical nature of the project and hopefully the impact of it as well. ACC&D felt that the lack of ethical guidance, specifically for field projects targeting dogs and cats, is a real problem. Ultimately, we want to do as much good as possible for animals, their guardians, and their communities, and we feel there should be a network of support to do this. So, with contributions from a host of experts, we've created a guidance document that talks about different ethical principles and how they may shape people's attitudes towards conducting studies or research projects, the process of ethical review, and ethical considerations to keep in mind when designing a project. We then have toolkits that take a deep dive into specific topics that are relevant to conducting projects or studies: ethical review, conflicts of interest, informed consent and permission, and data collection and use. There are additionally toolkits for each major stakeholder: animals, communities, owners, guardians, and caretakers, and then a specific toolkit devoted to stakeholder engagement. I want to briefly call attention to the many wonderful experts who contributed to this resource, who are listed on this page taken from the guide. These include experts at this conference: Kate Atema, Ellie Hibby, and Lou Tasker, who also served as a consultant on the project. And I'd be remiss not to also acknowledge the organizations that provided funding at various points in the initiative, including IFAW, International Cat Care, the William and Charlotte Parks Foundation, and the ASPCA. What's extremely exciting is that this ethics publication is hot off the presses, and you're literally the first audience to learn about its availability. So we encourage you to go to our website to download the resource, which is free, and take a look. We'll also soon be further expanding our webpage on this resource, and we encourage you to share to help get the word out. Lastly, I want to share some important links as well as email addresses to get in touch with ACC&D staff. Thank you so much for listening, and enjoy the rest of the conference.